Now we're going to move on to the next talk from Clare Advocate for people living with obesity, ASO patient representative trustee, European Coalition for People Living with Obesity, and Director of Bariatric and Metabolic Surgery Services for Obesity UK. And Ken's going to talk about the lived experiences of the impact of shielding during the peak of Covid-19 pandemic, a call for action. Thanks, Ken.
Thanks, Kath, and that's my title screen. Sorry it's so big. And two logos, Obesity UK and ECPO. Next to my affiliations, I'm a member of advisory boards for patient advisory boards for Novo Nordisk and for Boehringer Ingelheim. Next slide, please. We produced a paper that was published in the Lancet Diabetes and Endocrinology. And for me, it was a first. It's a truly joint paper. It was led by people living with obesity, and that was representatives from Obesity UK, which is a group of 40,000 members of people living with obesity in the UK, and the Obesity Empowerment Network, an advocacy organisation. And we produced this paper together with academics and healthcare professionals from ASO. Next slide, please. We spoke to people via social media, via email, via face-to-face support groups, and they gave us very clear messages. At the start of the pandemic, the biggest worry was misinformation. There was no real clarity at all about the risks that people faced. GPs were given inconsistent messages about shielding. People were watching every news bulletin on the hour, every hour. They were reading everything they could in the newspaper. And then in the worst cases, they resorted to Facebook and Dr. Google to find out what they could do. People were terrified about what would happen that if you caught COVID-19 and you had a BMI over 35 or 40. And at that point, there were no answers. People were worried about how they'd be treated. There's a lot of rumours that about people living with higher BMIs don't really get the best medical care, but that didn't seem to be the case for the people who were hospitalised. The messages that came out from people were more mundane, more simple things about, for instance, because you couldn't get visitors in hospital, you couldn't get nightwear to fit. The hospitals only had pyjamas to fit certain ordinary sized people, not people outside the normal sort of clothing ranges. We were able in some cities to provide nightwear banks to hospitals so as people could get access to some nightwear. And then big news came out about posturing, about this method of nursing people in intensive care units face down, and how that would help the situation. And then the message came out that that couldn't be done for people with a higher BMI, and people became truly terrified. At that point in the pandemic, we were, through Obesity UK, we were supporting people 3 times a week on online support groups. And it's interesting that the people who were coming forward were perhaps people that hadn't accessed face-to-face support groups that we'd had to close before the pandemic. Next slide, please. There was stigma, and there's lots of stigma about obesity. I've lived with obesity all my life, and I know I've lived with that stigma, and I've lived with it from the public. You can be abused in public. You can be spoken to by healthcare professionals in a way that is not really befitting the problems you've got. On top of that, that just feeds into your internalized stigma. Then it was whipped up by the media. And to be honest, I think that people living with obesity have been easy targets. And there's been fat shaming and bullying on social media. And there's absolutely no way that that can be controlled. And a lot of people have retreated away from those areas. Next slide, please. How does it affect people? Well, at the start, I was actually shielded for 2 weeks before any advice came out personally, because I got a bad chest infection and pneumonia. and my GP told me to take 45 minutes exercise. He didn't specify what period of time. I thought he meant a week. He actually meant a day. And I never achieved that. I never even got anywhere near 15 minutes exercise. And I'm one of the people fortunate enough to have a treadmill. Everybody I speak to almost universally reduced the activity during the period. People's mental health was affected. You felt lonely, depressed, frightened, scared, and just not knowing where to go. We've already seen an earlier speaker talk about the increase in alcohol. If you look on social media, you only have to see the number of drinks that are on Instagram and gin and cocktails and people baking, and then eating behavior. People self-soothed with eating because they felt that there was not much else they could do. Isolation was a major problem for many of the people who fed back to us. What about my obesity treatment, people asked. I'm on what's called Tier 3 weight management, which I think the previous speaker said was initially suspended everywhere. It started to creep back in different parts of the country. Some people have been pushed to the back again because they've gained weight during lockdown. Other people are just put on hold. And more people, the majority, still don't know where it's up to. Telemedicine, I've called a mixed blessing. And that is because it's made it really easy to contact your healthcare provider, unless, like my GP, he says that you're going to get a call tomorrow sometime before 6:30. That isn't really good enough. People have got to focus in on a bit better time slot. But one of the positives that people have reported is that it cuts down travel time. It also helps if you've got a practitioner who is difficult to bring weight up with. You don't have to face them face to face or her, and you can bring up the difficult conversation about getting healthy or weight management. It's easier sometimes not face to face. And now we're seeing about the return to the new normal. And I'm not sure what that new normal looks like yet. It's still emerging. People are scared. People have developed a reluctance to go out of the house. There's a lot of people where I live that are cycling and running, but they're people who probably would have done that anyway and have just got more time. Not many people that I talk to through the groups that we're running are doing more. People are worried about masks. People don't know that face masks, like you buy in your local supermarket, don't fit you if you've got a larger face. And we've managed to source someone who produces large face masks, hand sewn. And we've just put people in touch. We're not getting involved in the sale. Next slide, please. So our paper, the call to action was to clarify the risk of adverse COVID-19 outcomes. And it was really interesting to see the first speaker. And I really look forward to looking at the dashboard. We want to define the risk of infection and subsequent mortality. And it's great to see those big studies and what's coming out. We want clear guidance. We want to give people better messaging to reduce stigma. And some of the stuff that's come out recently is stigmatizing. We've got to improve access to weight management service, and we can always do more to offer training for healthcare professionals. And we want obesity recognised as a complex chronic disease. Next slide. So just to sort of tie it up, this was a great lesson in collaborative working. But if you're going to work together with people living with obesity, keep your language accessible. Avoid jargon. If you don't, I'll send you an email and tell you to take it out. Be prepared for questions. Make no assumptions. People like me generally don't have the same resources as a university to enable collaborative working. So even things that you consider simple, like referencing and signing electronic documents, can be hard. If you do all that, next slide, you'll get an awesome result, like we did working together. And I think I've finished on time.